Welcome to week 12 of Environmental Health Issues, everybody. This week we're going to try and give you a few good news stories, and I'm going to talk to you about hospitals without harm, and I'm going to just try and share my screen with you before we start. Healthcare agencies, start screen share. Here we go. Healthcare agencies are major consumers of natural resources, as you would well know, and producers of waste. And but beyond legislative requirements that aim to minimise environmental degradation caused by these agencies and create healthy environments, there are a good many useful guidelines and tools available to assist organisations to assess the impacts of or their footprint, if you like, of their operations of the organisations, and also to create a healthy space for people who come into contact with that organisation, whether that be patients or staff. And this dictum, first do no harm, it doesn't exactly come from the Hippocratic Oath, although some people think it does. It does come from the Hippocratic Corpus in essence, and it is the logo on the Healthcare Without Harm organisation, which is a coalition of various groups, as you can see here, who are concerned about the environment and recognise how important a healthy environment is to human health. So there's an international coalition of hospitals and healthcare systems, there are medical and other professionals, there are community groups, unions, and so on. They have a number of plans, if you like, or areas that they concentrate on. So there are numerous projects in any number of countries around the world. They mainly fall into these categories. So the global green and healthy hospitals, mercury in healthcare, climate and health, safer chemicals. And we're going to just have a little bit of a look at the global green and healthy hospitals project, if you like. So as I said, the healthcare sector itself makes a significant contribution to environmental degradation through merely the operations, so through the products and technologies we employ, the energy and resources we consume, the waste generated and the buildings constructed, the way things operate. There is a significant source of carbon emissions amongst other things, and therefore an unintentional contributor to climate change. But this Global Green and Healthy Hospitals network is composed of organisations across the globe and health systems representing more than 4,000 healthcare institutions from around 6 continents, and that network looks at reducing their ecological footprint and promoting environmental health. So it's quite, and you can see here some of the things they look at is medical waste and toxic waste, safer buildings, green buildings, food, pharmaceuticals, and so on. They have 10 goals, and so they look at showing leadership in their communities, prioritising environmental health as a strategic imperative. They look at chemicals, and so they try and substitute harmful chemicals with safer alternatives. They look at waste, reducing and treating waste safely, and deploying on-site renewable energy technologies such as wind and solar, better building designs, water recycling, and it goes on. The list goes on. And there are a number of examples, as I've said, around the world. Each goal contains a series of action items that health systems can implement, and most organisations start with one or two, and they chart the course of those their achievements in those one or two goals before moving on. So they look at, as I've said, energy, clean and efficient energy, renewable energy sources. They look at recycling water. They look at transporting staff and patients getting to and from the healthcare agency. Food, obviously, is an important one, where how food is purchased, where from. Is it sustainably grown? Is it healthy? Prescribing appropriate pharmaceuticals. Of course, support green and healthy hospital design and construction, and purchasing, so buying safer and more sustainable products. They work in collaboration with other organisations such as the Global Climate and Health Alliance, and that alliance has helped produce or develop some information for health workers on climate change. So they've got these climate change infographics, which are attractive and informative. Talk about, if we act on climate change. So they say greatest health threat or greatest opportunity. So thinking about all of the impacts, if you like, of climate change. And similarly, these three infographics too. So with the aim of educating and training the health sector to speak out for policies that promote a healthy climate. They work with thousands of health systems in dozens of countries to help them reduce their carbon footprint through, as I've said, energy efficiency, solar, wind and other solutions. They are also a lobbying group, so pressuring politicians at the local level and national level and also the global level to protect public health. And there are a number of journals now, the Lancet, British Medical Journal, and other journals who are involved in this, pressuring politicians and putting the evidence out there, publicising the health impacts of climate change, amongst other things, through media campaigns. And just as with smoking, we know that climate change is hazardous to human health, and there may be some industry protests around this, but the science is clear, and to protect the public as health professionals, we need to be part of these sorts of conversations. There are a number of examples in Australia. One other group that works in Australia is the Green Building Council of Australia. They have introduced a Green Star health rating, and this is a rating tool available for use by health agencies, community health centres and hospitals, aged care facilities, mental health facilities, you name it. And the healthcare organisation projects, they are awarded this Green Star rating based on accumulating credit points. So in various categories, I won't go through them all, but energy and water, obviously, their transport policies, facilities, in the organisation, recycling, land use management, and so on. I've got a picture here of the Royal Children's Hospital in Australia, and when they started their new hospital, they wanted to reduce their greenhouse gas emissions by 45% compared to the conventional hospital. I don't know how they're tracking on that. There was a 20% reduction of water use by their on-site water treatment plan and water efficiency measures, rainwater collection, and so on. And you'll see here I've put the logo up of the Green Star program. And there are also health professional organisations. I've just put a couple up here: Doctors for the Environment, Alliance of Nurses for Healthy Environments, and whatever profession you belong to in the healthcare area, there are probably going to be policies in your organisation around these issues, and I invite you to go and have a look and see where, just exactly what policies are there in your professional organisation. There are other hospitals and organisations, of course. So I guess my advice to you organisations are starting up green teams. They're usually in small groups of people in various departments and so on, and they write out a goal or some action areas that they want to achieve to reduce their carbon footprint or water usage, or want to improve their waste disposal, whatever it is. They start that. So my suggestion is look for a green team. Thanks very much.